Alright, so the next technique I'm going to show is going to be the Cuboid Whip. This is going to be for patients who have an inversion ankle sprain. That's going to be the most common. And the cause of this is the cuboid moving out of place. And so this Cuboid Whip is actually going to help replace it back into the correct position of where it's supposed to be. And there's objective findings for this. If the patient has pain on palpation of the cuboid, if there's positive metatarsal mobility test, if there's a positive dorsal and plantar mobility test, and then if the patient has some antalgic gait as well. And so what I'm going to do is I'm going to be moving the foot laterally and dorsally. So I'll have the patient lying prone in this position here. The therapist will come down to the affected leg, which is going to be the left leg here, and then I'm going to take the foot like this, and I'll have the patient just relax. And so what I'll do is I'll move my hands distally to the calcaneus and move it down right over the navicular, right over the cuboid bone, and I'll move the tissue out of the way, and I will lock my hands here, and I will give a I will just kind of move it back and forth just to relax the muscle tissue here. And then I'll give a high velocity thrust here. And that's going to be, if there is cavitation or not, that doesn't mean it didn't work. But with that Cuboid Whip, it should help replace it back the cuboid in the correct position, so the patient will have decreased pain, increased range of motion.